Hello guys, our today's topic is on Exodontia. So what is Exodontia? According to the as stated by the Howe, an ideal extraction involves the painless removal of the entire tooth or the root with minimal trauma to the surrounding tissue. So the goal is to facilitate uneventful wound healing. Now what are the techniques of the dental extraction? Let us discuss that. There are two main technique. One is the intraalveolar extraction, also known as traditional or conventional extraction, and other is the transalveolar extraction, or it is also known as surgical extraction. The intraalveolar extraction, it is a closed method. So remember, it utilizes specially designed dental forceps or the elevators. So it is ideal for straightforward cases termed as, it is also termed as simple extraction, and it is not suitable for cases with the root deformities, hypercementosis, brittle teeth, or the endodontically treated teeth. The other is the transalveolar extraction, that is also known as open method. So as it is open method, that is why it will involve a surgical flap technique. So it involves a surgical flap technique, alveolar bone removal, and tooth sectioning, and it is applicable in the complex cases or complicated extraction. The third method is the Toby technique. So suppose you have to extract multiple mandibular anterior teeth. So this technique, it is used for extraction of the multiple mandible anterior teeth. So here, uh, so by the use of the dental elevator, it is a technique that is used for extracting multiple mandibular anterior teeth, and it involves the use of dental elevator for efficient teeth extraction. So, so the here the adjacent tooth can be used as a fulcrum, and and it is used for extracting multiple mandibular anterior teeth. Now let us discuss the common indication for the tooth extraction. Why do we need? What are the indication of the exodontia? First, it can be it is it is usually required in case of severe caries. Second, severe periodontal diseases, when the tooth is not salvageable through the periodontal therapy, or condition affecting the tooth structure beyond the repair. Or it can be also performed in case of over retained deciduous teeth, tooth with necrosed pulp, and periapical lesion, the teeth that are not responding to the endodontic treatment. So malposed teeth, presence of extra teeth, tooth that are causing constant trauma or are prone to caries, impacted teeth, teeth that are in line of fracture. So teeth that are involved in the fracture line, they are extracted if they are source of infection or they interfere with the fracture reduction. Other causes could be tooth that are directly involved in pathology like cyst or tumor, tooth with a poor prognosis in case of radiation therapy, tooth that are with vertical fracture or cracked tooth syndrome. So all these are tooth that are vertical fractured. Sometimes during the orthodontic treatment, you need to do extraction in order to treat the malpost or crowding or serial extraction. So all these are sometimes in the orthognathic surgical procedure. Uh, you need to extract the tooth. So all these are indication for the exodontia. Now let us talk about the contraindication. Contraindication, first of all, what are the absolute contraindication? So, so remember central hemangioma. Uh, it is an absolute contraindication due to risk of uncontrolled bleeding or patient with AV malformation, that is arteriovenous malformation. So it is absolute contraindication due to potential for severe bleeding. What are the relative contraindication? The relative contraindication, infection in extraction areas that could tooth with local acute cellulitis, as the infection in the extraction area that could spread during the procedure. Patient with acute necrotizing ulcerative gingivitis. Caution is required due to the compromised state of oral tissue. Uncontrolled diabetic mellitus patient. As the poorly controlled diabetic patient, here there may be impaired wound healing, and due to that there could be increased risk of infection. Hypertensive patient, blood pressure should be stabilized to prevent the complication during extraction. Bleeding disorders, conditions like hemophilia that could lead to excessive bleeding during the procedure. Patient with cardiovascular significant heart conditions may require precautions. Impaired liver function can affect the drug metabolism and hence influence the healing. Patients who are on long-term steroid therapy may require careful consideration. Teeth that have undergone radiation uh, therapy, generally it is contraindicated in for 6 months to 1 year. So these these are the relative contraindications. So when the patient, remember, who has undergone radiation therapy, it is important to wait for specific period, that is 6 months to 1 year before performing a dental extraction. So as the radiation, remember, it can compromise the blood supply, increase the risk of osteoradionecrosis, and that is why it will impact on the healing. Suppose a pregnant lady come to your clinic. We know the pregnancy, it is divided into 3 trimester: first, second, and the third trimester. So remember, the first trimester and the last, that is the third trimester, they require special attention due to the crucial fetal development and there are due to the potential physiological changes. We know that in first trimester there is marked organogenesis and there is fetal development. So during week, uh, so it is advisable to avoid a drug that may pose potential risk to the fetal development. In the second trimester, remember, the second trimester is relatively safe and more stable period. So dental treatment can be planned during this time, but communication with the gynecologist is important. The next is the third trimester. In the third trimester, what you can see is supine hypotensive syndrome. during dental treatment in flat position. To avoid this, patient is patient should be positioned in which position? Left lateral position, that would facilitate the better venous return. So remember, what is the position of in patient with the pregnancy? It's the left lateral position. Now let us discuss the positioning of the patient during the extraction. The angulation of the dental chair is important for effective extraction procedure. For the maxillary teeth, you have to tilt the chair backward at the 60-degree angle to the floor. So the you have to tilt the chair backward, adjusting the maxillary occlusion plane to 45 to 60 degree when the mouth is fully opened. And for the mandibular, you have to keep the chair straight and adjust the mandibular occlusal plane that should be parallel to the floor. So here the mandibular occlusal plane should be parallel to floor, and in maxillary teeth extraction, the maxillary occlusion plane should be 45 to 60 degree when the mouth is fully opened. Now what should be the height of the dental chair? For maxillary teeth extraction, the occlusal level should be 8 cm below the shoulder level of operator. For mandibular teeth, the chair should be below the level of operator elbow. Now the height of patient mouth should be at or slightly below the operator elbow. So remember, for the extraction in the maxillary and mandibular right and left quadrant, the patient head should be turned toward the operator, and for maxillary and mandibular anterior extraction, the patient should look forward. For anterior tooth, the patient should look in forward direction. For extraction of left or right side, the patient head should be turned toward the operator. The third important is, during the extraction, the force delivery should come from the arm and the shoulder, and not from the wrist or the hand pressure. So that would reduce the risk of musculoskeletal strain on the operator. Now what is the position for the operator for various extraction? The operator should stand in front and slightly on the right side for most of the extraction, except for the right mandibular teeth. For the right mandibular molar teeth, they should stand slightly behind at 11 o'clock. So for the mandibular anterior teeth, you have to stand in the front in 8 o'clock position. For mandibular anterior teeth extraction. So during the extraction of the left maxillary teeth, the left thumb should support the palatal alveolar bone. The left thumb should support the palatal alveolar bone. The index finger, that helps to retract the buccal tissue. And for right upper teeth, the left hand thumb should retract the buccal tissue, and index finger should support the palatal alveolar bone. So for lower left teeth, the left thumb should support the mandible, and the index finger retract the buccal soft tissue. So in operator positioning, remember, it is an important aspect of the dental extraction that would ensure comfort, stability, and precision during the procedure. So these are the position that are generally considered. Now let us discuss the various forceps that can be used for the maxillary forceps. Remember, these are the forceps that can be used. Straight forceps number 1. So this one is the that is used for maxillary incisors and canine. Other is forceps number 65, 150. So this one is the 150A forceps that is used for the premolars. Other is number 53 forceps, number 210 forceps, 296 forceps, and number 88 forceps. So these are the forceps. Forceps number 88 cow horns, they are used on maxillary first and second molars. Forceps number 286 bayonet forceps for extracting maxillary anterior teeth, and the roots may be used for the bicuspids. So remember these forceps. For mandibular teeth, these are the forceps. We can use this 151 number for the anterior teeth, 151A forceps, number 17 forceps. So these are the forceps that can be used. Number 23 forceps, number 22 forceps, triple 2 forceps that is used for the mandibular third molars. So these are the various forceps. Cow horn mandibular forceps. So that has the shape of a cow horn, and it point the beak entering into the bifurcation of the lower molars. Now let us discuss the principle of elevation. There are three types of principle. One is the wedge principle, second is the lever principle, and third is the wheel and axle principle. So the first is the lever principle. So imagine you want to lift a heavy object like this big rock. Now you don't want to use all your strength to lift it directly. This is where the lever principle it comes in. A lever, it is just like a seesaw, or that would help you to lift something heavy by applying smaller force. So dental elevators work similar like this. So remember, it has a fulcrum. So this one is the fulcrum. So it is like a pivot or hinge of the lever. So in this case, in the case of dental extraction, the fulcrum is where the elevator is held, typically near the handle. Second is the effort. So the effort. So this one is the effort. That is the handle. Think of effort as a power you use to lift or move the tooth. In dental forceps, the effort is the force that is applied by squeezing the handle together. The resistance, this one is the resistance. The beaks, resistance portion is the beak. So it is like the force you are working against the resistance of tooth. In forceps, the resistance is the tooth that you are trying to extract. So for a lever principle to work, you should have a longer handle. So imagine you are using a pair of pliers. If the handles they are short, it is harder to squeeze them, right? But if the handles they are longer, you can squeeze them with less effort. That is what we mean by effort arm. So the effort arm should be longer than the resistance arm, that are the beaks. So for the dental forceps, you want to use this lever principle. The handle represents your effort and the beak are the resistance, the tooth. So by making the handle longer, you gain a mechanical advantage at the shorter working end or the blade that engages the tooth. So that is especially seen in elevators like the Coupland elevators. Other principle is the wedge principle. So similar with the elevators. So think about wedge like a knife or axe. So it is a sharp pointed tool that you can use to split things apart. So in the case of dental extraction, we use a kind of movable inclined plane. So picture two inclined planes like a ramp. They come together to form a sharp angle. So this is the wedge. So one side is the base where you apply your effort and other is the slant side where resistance feel the impact. So when you push the base of wedge, the slant side exert force on whatever in its way. So sharper the angle of the wedge, the easier it is to overcome the resistance. So even a dental forceps they use the wedge principle. The narrow tip is like a mini wedge. We sneak it below the gum line and then by gently expanding the bone we make the tooth extraction a smoother process. The third is the wheel and the axle principle. Imagine a wheel that is connected to a central pole. So this device is like what you can see on the bicycle. So when you pedal, the wheel turns and you can cover a lot of ground. So when you apply a torquing force to the wheel, it winds a rope. It winds a rope or chain on the axle. So in dental extraction, this torque it helps to lift a heavy load. So picture a crank handle on the side of the wheel where you apply a light force to turn the crank. So it creates a torque around the axial central fulcrum. So this force is helpful in lifting the object. So this torque is what helps to lift the heavy load. So the effort we apply to the wheel circumference and the wheel turns the axle, so it raises the weight. So larger the diameter of the wheel, remember, more mechanical advantage you get. So what are the elevators? The straight elevator, remember, it works on lever and wedge principle. The crier elevator works on lever principle. Apex elevator, Pexo elevator work on lever and wedge principle. The crossbar elevator works on the wheel and axle principle. So remember here the mechanical advantage is largest among all, that is 4.6. Now let us discuss the forceps technique we use in the tooth extraction. The forceps we know they are commonly used for the tooth extraction. However, they are not suitable for cases involving the hypercementosis, root deformation, grossly decayed roots, or the brittle roots. So what are the advantages of forceps crowns? The technique has advantage as it causes the least trauma to the gingival fibers, reducing the size of extraction orifice that would turn a faster healing plus faster and smoother healing. So remember uh, that the beak of forceps should be seated as far as apically toward the root tip. The beak Remember, the beak should be parallel to the long axis of the tooth, and the excessive force should be avoided. So these are the various movements that are used for extraction of the individual teeth. Remember that the upper central, lateral, canine, first premolar, second premolar. The forces are the first apical, then slightly labial, uh, or the buccal, slight palatal, and rotation with the traction. So remember the forces. Now the lever principle, we know that most of them are class 1 and few are class 2 lever. The elevators that use lever principle are the straight elevator, apex elevator, and the mechanical advantage is 3 here. The arm should be greater than the resistance arm. For the wedge principle, uh, working elevators that are working are the extraction forceps, straight elevators, wedge elevators, and mechanical advantage is 2.5. For the wheel axle, example are the crossbar elevator or the winter elevator, and mechanical advantage is 4.6. Now next are the elevator. Elevator, we know they are used when the beak of the forceps cannot easily engage teeth. So it is common for the impacted, malposed, or severely damaged teeth. Elevators are effective in removing roots. So never use adjacent teeth as fulcrum unless the tooth is also being used. So be cautious with the buccal plate. Except for the third molar, avoid using the buccal plate as the fulcrum. Always use finger guards to protect the patient in case of if the elevator slip. Always use interseptal bone as fulcrum for better control. Avoid using an elevator to luxate a tooth that has a tooth distal to it. So Stobby's extraction, we discussed already that Stobby's technique involves extraction of the multipolar mandibular anterior teeth using elevator. So it is used when multiple mandibular anterior teeth are uh, to be removed. Other is the rubber band extraction. So rubber band extraction, remember it is indicated a patient with bisphosphonate therapy or the hemophilic patient. So rubber dam extraction, it is gentle alternative in a patient who are undergoing bisphosphonate medication and are at risk of developing osteoradio necrosis. We know hemophilic patient, they would have impaired blood clotting, and a traditional extraction method may lead to excessive bleeding. So, by using the rubber band extraction, that minimizes the trauma and reduces the risk of bleeding complication. So, in case of rubber band placement, you have to select a strong, durable rubber band that can withstand the forces involved in the extraction. You have to place the rubber band around the target tooth and engage it below gingival margin. So ensure that the rubber band is securely positioned, providing a stable grip for the tooth. Now a gentle traction force is applied to the rubber band. So this force would dislodge the tooth from the socket by exploiting the periodontal ligament viscoelastic property. So gradual application of force that would provide a controlled atraumatic extraction. So once the tooth it exhibits sufficient mobility, it can be gently lifted from the socket. So this is rubber band extraction. The other is the lingual split bone technique. Remember, it was given by first Williams Kelsey Fry and later popularized by T. Watt. So it is used for removal of mandibular third molar, particularly those tooth that are positioned lingually. So remember, there is risk of injury to the lingual nerve. Also, there are chances of dislodging the tooth or root into the sublingual space. So the lingual split bone technique, remember, it involves creating saucerization of the socket using specific instruments. The saucerization refer to the creation of concave or saucer shaped configuration in the extraction socket. So after the tooth extraction, a blood clot formed within the socket. So this blood clot is vital part of the initial healing process. The other technique is Murray-Gibber's collar technique. So it is a modification of Sir William Kelsey Frey split bone technique. So it uses a burr for removal of impacted mandibular third molar. So here it allows for the removal of a calculated amount of the bone as block, including the distolingual angle of the bone. The third other is the Boulder Henry technique. So it was given by Boulder Henry. So it is designed for trephinization of the buccal bone lateral to extract the partially formed unerupted third molar. So trephinization refers to the surgical procedure in which circular piece of bone it is removed. So it involves the removal of the buccal bone lateral to the partially formed unerupted third molar. So the primary objective is to create an opening or window in the buccal bone, providing the access to the impacted third molar. Now important is what are the policy for leaving the root fragments. So three conditions must be there for if you want to if you want root to left in the alveolar process. The root fragment must be small. The root must be deeply embedded in the bone. And third, the root must not be infected. Other is the transalveolar extraction. We know it's an open method uh, and it is indicated in the retained roots that are in close proximity with the maxillary sinus, geminated or dilacerated tooth, or history of difficult or attempted extraction. So these are the indication. Now what are the steps in case of healing of extraction socket? First of all, there would be hemorrhage and clot formation. It is seen in 1 to 2 days. Then there is organization of clot by the granulation tissue. It occurs the day it's the duration is 3 to 7 days. Then there is a replacement of granular tissue by the connective tissue with the epithelialization of the wound. It occurs in 4 to 35 days, and then there is replacement of connective tissue by coarse fibular bone, and the last is reconstruction of the alveolar process, and there is replacement of the immature bone by the mature bone tissue. What are the factors that would influence the healing? The infection, size of wound, foreign bodies, general condition of the patient, the blood supply. These are the factors that would influence the healing of the wound.